I'm Julia Lumb and I am the lead for the Early Years SEND and Portage team. We support children who are under 5, and when I say under 5, that is taking children right to the end of their reception year. It's a phase of education called Early Years Foundation Stage, and we really support children from birth through to the end of their reception, which is their first year in school. I've been asked today to come. I could talk to you for hours, and I know many of your faces in here already, but I've been asked to come and talk to you today specifically about the work that we've done with reception age children this year. Our reception school, our classes, our schools, our numbers of children is rising, as you may imagine. We have had something like 200% increase year on year of the numbers of children coming through. So for this current reception year, we have had 335 children in reception classes. And those are children who have got at least a 50% delay in their learning and development. Most of those children have got a communication and interaction difficulty. Many of them also have a cognition and learning difficulty. Most of them have some kind of sensory needs as well, and as you can imagine, that impacts on their personal, social and emotional development, which in the code of practice is called SEMH, so social, emotional and mental health needs. So a big range of children that we've got in our current reception classes. 185 in total had an EHC plan. Now, these are the children that went into mainstream reception classes. Last year, we also sent around about 40 to 45 children into our special schools. So those children had had intervention and were prepared and took up their special school places. And many of you will know that the children who started school last September, there was a bit of a kerfuffle when many children didn't get the specialist placements that they wanted last year. Now, what we did was we wrapped around those families, we wrapped around those schools, and we took at least 33 of those unhappy outcomes and took them into school, wrapped tightly around the school in terms of adding additional support and provision into the school from our team. That has meant at times weekly full days from a member of staff working closely in with the mainstream classes to upskill the teachers and support staff and to give them the confidence that they need to be able to meet children's needs. Now, perfectly, things have worked really well. Those children have got to the end of their reception year. Many of those children are staying in reception for their year 1, so that's been a real success, and we know that that only happens when we all work together. So for us, working very closely with the family, but also working closely with the early years provider before children went into school, the school that has received those children and is working with them through their reception, but also with all the other services that wrap around those families and their complexities. So we've supported 56 schools this year, and that's an extension of what we have done previously. We've had to do that, we wanted to do that, and it's been right to do that. 56 of our reception schools. We've also had our mainstream schools developing differentiated classrooms to meet the needs of those children. So alongside their mainstream classroom, we've got probably about half a dozen at the moment who are also running additional classrooms specifically for a small group of children. So we have one up at Withenfields, one up at Moorside, one down in Ash Green, one out at White Hill that we started last year, and a couple of others. Those have been really successful. We've wrapped even tighter around those to upskill and make sure that everything is in place for those. And beautifully across the year, we are now starting to extend that out into more and more reception classes, because we know that the needs coming forward in this next year's reception is just as high as last year. We are in a space of a new normal around the numbers of children coming through with a high level of need and the levels of complexity in SEND, and working in partnership with our mainstream schools, we are adapting, coming up with bespoke solutions that fit community schools in the way that work for their communities and families. So we're really pleased and proud of that outcome this year. Alongside that, we have just a bit of context about the children that we're working with. Like I say, most of the children are working at least 50% below their age-related expectation. So that would be a 4-year-old whose development is at a 2-year-old, or a 3-year-old at a 1.5-year-old. But a big chunk of our children, so let me just work out this as a percentage, about 30% of those, 30 to 40% of those children are working, so they're 4-year-olds who are working at less than 12 months age-related expectation. So there is a massive gap. We're not just talking about 50% below, we're talking 75% or more in a delay. But our schools are adapting and creating provisions and working really closely with not just the local authority, but with health partners as well, to make solutions happen in local schools for local children, which we are proud of and is part of our priority. In terms of support for schools, alongside that, we've been running the Dingley's Promise improving inclusion work. That was a comic relief bid that we were proud to secure 3 years ago now. And we are, out of 30 local authorities, we are ranked 3rd in having settings that have achieved their mark of achievement, which is a kite mark for inclusion. We have 7 schools in Calderdale currently with their mark of achievement, and we have others in the pipeline who are working hard to get their mark of achievement achieved by the end of this academic year. So we know that that is rising. We've trained over 1,800 practitioners who've had access to the Comic Relief funded training. It is open to parents as well. If you are a parent and you are interested in accessing that training, we can help you to access that. And we have our parent advocate here. Kirsty is a great champion for our Dingley's Promise work. And we are bringing on board not just schools, but all our early years providers, our childminders, and also families to make sure that we have a really good basic understanding of what inclusion should look like when meeting the needs of children, to enable them to access their full early years entitlement. Because just like Charlie was talking about, some of the year 11 children start to not be able to access everything, and we look at exclusions at the top end of schools. We also find that in the very early years as well, that some of our children are not having access to their full 15 or 30 hours entitlement. So we're working hard for that as well. Coming forward into next year's reception then, we've got 300 children on our live caseload at this moment in time. 111 of those have got EHCPs, and 130 children in our collection have already either got a diagnosis of autism or are on the neurodevelopmental pathway. A big piece of the work that we do with the children younger than starting school is around earliest identification, finding out what those needs are and getting early intervention in place as soon as possible. And that doesn't always take place in a setting. Sometimes that takes place in the family home, and we run something called the Portage model of home visiting, which enables families to access the early education support that they need for their child in their own home, working in partnership with specialists. We have seen a rise in numbers of children who are at home, and that is because there are still some barriers, in fact some increasing barriers for families to accessing inclusive early years provision. So we're working hard to address those barriers, but we also have an offer for children who are at home so that they have plans in place to support them to access their formal statutory education at the beginning of reception. What else can I tell you about that? So our -2 cohort, which will be September 26 starters, so jumping forward a little bit, which are the children we're already planning for. We've currently got 213 children on caseload. Only 11 of those have an EHC plan at this moment in time, but we are planning and working for their entry to school for September 2026. When we get to that age group, we're working mainly across the private, voluntary and independent sector around preparing and planning and helping those settings to see the full journey through to the end of reception. And there's a big piece of work for us to do around joining those two elements up, the very preschool and the end of reception. But that's a big piece of work that we've been doing in terms of that transition work, and getting children ready. There is a big focus for us around something called ordinarily available provision, also called mainstream inclusion Calderdale, And for us, Mainstream Inclusion Calderdale starts early, right at the beginning. So our launch of Mainstream Inclusion Calderdale Early Years is taking place on the 10th of October. And we are in the process of co-producing some documents and guidance for families and for settings around what good inclusive practice looks like. So that's our key priority. And we're sneaking in a little bit ahead of Mainstream Inclusion schools because actually it starts with us, okay? So we want it to start with us, so we go in early. Other things that we do is we provide training either directly from our team, but we also commission in training, something called intensive interaction, which is the very early stages of communication. We run that training every term so that it's accessible to all our professionals, and we're looking to run an intensive interaction for families course in the autumn term. So watch out for that one. We also run Macathon training. Again, we're looking to source that for families as well. We work very closely with our family hubs, and the family hubs in Calderdale have recently been recommissioned, and Dingley's promise and the work with the early years Send and Portage team is threaded through that new commission, and we're looking forward to being able to offer more opportunities to engage with the services, but in locality bases where families live, because it can be really difficult as a parent to get all the way into Halifax to access services. So we're going to take it out on the road, and we're going to be in those spaces. Our -3, -4 and -5 cohorts, so that's our tiny babies. We've got just short of 70 children in that group of children. And unfortunately, that's not enough for us, okay? So we're really, really busy, but we would like to have these children referred to us much earlier, because the sooner we can get in, the bigger difference that we can make and the less panicked and rushed it feels for families. So we have started a piece of work with the neonatal team at the hospital, because we know that many children have experienced difficulties in their very early stages of arriving in this world. And what we know is that if we can get in early, we can put some reassurances in for families about the whole journey through to school, because who doesn't start worrying about school sometimes even before babies are born? So we need to get that reassurance around families happening at that point. So we are the earliest intervention, the earliest point of identification. We take referrals from parents, we take referrals from all professionals. If there are any questions you have about how to get into our service, we are overrun with lots of children, but we want more, okay? Because the sooner we get involved, the easier it is for everybody, the smoother it will be. And we will then be able to help children into their key stage 1 part of their education in a smooth and successful way. That's it from me.